Hi, I'm Dr. Meri Rosco, and I want to continue to talk about decompression therapy today and really what to expect during the treatment. So the treatment should last anywhere between 10 and 20 minutes, and that will be determined by your particular condition and what the chiropractic physician thinks is the appropriate treatment time for you, as well as how many sessions you need. It's always hard to say at first because you're not sure how the patient's going to respond to the treatment, so that might take some time. However, it could be as many as 20 to 40 sessions, so you want to be prepared for that. It should be a very gentle pull. In fact, the first few visits, you might not really feel anything at all because it's so subtle. And that's what you want. You want to really ease those joints and the ligaments and everything into that pulling motion without causing any kind of pain or muscle spasm. So it should be really slow progression. And as long as you don't feel any soreness, then you get bumped up and have a greater pull each time until you get to a level that seems to be working for you. It shouldn't be painful during the treatment. It should be relaxing and, like I said, just a gentle pull. So if you feel any pain or any discomfort, you need to let the chiropractic physician or the chiropractic assistant know right away so they can adjust the settings on the machine for you. Now, what you should notice as far as pain reduction or your symptoms getting better as you're treating the problem. Usually when you are put on decompression therapy, it's because you have pain coming from the neck that's radiating somewhere, whether into the shoulder, the elbow, all the way down to the hand, or in the low back and going somewhere down the leg or even into the foot. So that's when you have radiating pain. Now, that's not always the case, but usually when a patient has that, it's a disc injury and they use decompression therapy. So what you should notice at first is obviously a reduction in pain. And I'd say probably 90% of the cases that I've treated with decompression therapy, the pain reduction has occurred in the extremity. So if there's pain in the hand, you start to notice less pain in the hand. Now the pain in the neck might remain the same, or if it's in the low back, the pain in the foot or the pain in the calf might start to decrease, although the pain in the low back remains the same. So that's what we call that, is that the pain is becoming more localized. That's not always the case. Sometimes a patient's neck pain or low back pain will start to feel better before the pain in the extremity actually feels better. But typically it's the other way around, although everybody's different, so I wouldn't be discouraged if that's not the case. You just want to notice some changes happening, and it could take a few visits, could take 5 to 10 visits before you start to really notice a difference. And that's really just because we're trying to get that joint to a pull that it's comfortable with, where it's starting to become effective at rehydrating that disc to take the pressure off of the nerve. If you have any questions or you want me to talk about anything in upcoming videos, be sure to post in comments and I'd be happy to. I am planning on going into conditions that can cause degenerative disc disease and warrant decompression therapy in the upcoming videos. So anything related to that or decompression at all, just let me know. Thank you.